Hi guys, welcome back to my channel. So in this video, I'm gonna talk about my last day of clinical today. So today is my last clinical for obstetrics, and it feels like everything happened so fast. I just started clinical yesterday. If you're busy, sometimes like you don't notice that the time goes by fast because definitely we had a lot of exams, uh, clinicals, projects, assignments, teamwork. So all of those. So today I was so happy that I got to see a cesarean operation. So it's really amazing seeing up close, like what's going on with the patient, how the doctor do the stitching and kind of like control the bleeding, and even the CRNA trying to like keep the patient at ease, not really feeling the pain. Of course, the patient would feel like scared because it's like a normal reaction for like invasive procedure, right? And it was also fun seeing a lot of people like in the healthcare team like trying to like work together to make sure that everything goes well. And if somebody needs help, like, hey, do you need some help? And then somebody would like volunteer to help out, like whether it's gonna be a supplies, like more supplies, or just random things, just support, asking people um, to like if they're alright or not, right? Especially like some patients would have probably like a certain person inside the room. And yeah, so watching C-section was like really one of my goals in this clinical, and I was fortunate enough to see it at least like for the first time. And once somebody underwent C-section, after the sutures are done, then they're gonna be like taken care of. So as a nurse, like we had to make sure that um, the patient's not losing too much fluid, of course, because like there's gonna be a blood loss whenever there's a surgery. So the body would try to uh, react to it by having the blood pressure go down. So our job is to actually stabilize the blood pressure by giving more fluids and making sure they're not dehydrated. So that's a job. And also because it's a surgery, we made sure that the patient doesn't not gonna or that it's not gonna have any infection and stuff like that. So it was cool to see that, and that's like a big thing. Uh, Aside from that, just knowing all the operations that is going on in a labor delivery unit, because like when the start of semester, we had to learn some different terminology, different acronyms, and then as a student you just need to like memorize all of it. But now being in clinical, and then having those concepts learned from the previous lectures, it's easier to tie all those things together and it makes more sense. So it's really helping me now creatively and then critical think of what's what needs to happen, and then what's the purpose of every action in the unit. Yeah, so next week we have our last exams for all of the remaining course that we have, and aside from that we're done with the semester. And next semester would be start of our last year in nursing. So it's just like crazy. I'm kind of nervous a bit because I know it's gonna be challenging semester next year. I mean, because it's gonna be more advanced medical surgical, and yeah, but too early to worry about it. So, all right, guys, I just want to give you guys an update, and then again, thank you for watching this video.